just wanted to welcome participants to our Survive and Thrive webinar series. We're so glad to have you all here with us today. I'm going to introduce you to Monica Fawzy Bryant and have her go ahead and take over and start to share her screen.
Thanks so much, Rachel. I'm delighted to be here today to talk a little bit about strategies and tips and ways to deal with the financial impact of a cancer diagnosis and treatment. So I am a cancer rights attorney and chief operating officer for an organization called Triage Cancer. For those of you that aren't familiar, Triage Cancer is a national nonprofit that is dedicated to providing education on all of the legal and practical things that come up after a diagnosis. So I sometimes say it's all the things that come up that aren't discussed necessarily in a doctor's office, but we think maybe should be. So how do we provide that education? We do it in a number of ways. And I just want you to know that in addition to Texas Oncology, moving forward, Triage Cancer can also be a resource for you on these legal and practical issues. When I talk about legal and practical issues, a lot of times people will say to me, like, well, what's legal about cancer? And my answer is actually almost everything, from what drugs you have access to what your insurance companies do or don't have to cover, to what rights you have at work, to estate planning, to finances. All of those issues are actually grounded in the law, and they're all topics that we educate on at Triage Cancer. And we do that education through events, materials, and resources. So throughout today, I'm going to be pointing you towards resources on our website that are available and some other programs where if after today a question comes up that you maybe didn't think about or you weren't able to ask your question today, you know where to go to get answers to those questions. Now, when we talk about medical debt, unfortunately, it is an all too common issue. We know that in this country, about 4 in 10 individuals end up having medical debt, and 1 in 5 don't expect to ever be able to pay off their medical bills. And there's some misconceptions about who it is that may be dealing with medical debt, like people who maybe didn't do what they were supposed to do and have health insurance, when that's just not the case. We also know that there are some really significant implications when people do have medical debt, and that includes not being able to access the care that they need or having to cut down on basic needs. And so we think this issue of medical debt is something that absolutely needs to be addressed, and there isn't a magic bullet solution to addressing this issue. In the cancer community, especially among researchers, there has been this term that they've created to talk about the medical debt, which is financial toxicity. And financial toxicity really is about the burden, the financial impact that a diagnosis has on people. And we've been talking about this issue of financial toxicity for years and years and years, yet people are still experiencing it. And we think that one of the reasons they're still experiencing financial toxicity is that there are multiple contributing factors. And if we as a healthcare ecosystem aren't addressing all, or at least most of those contributing factors, we're never going to effectively help people avoid financial toxicity. And the number one most significant factor is somebody's health insurance status. Now, I will tell you, sometimes that means not having health insurance at all, but more often what we find is it's people who don't have the right policy for them, or they just don't have the tools to be able to effectively use that policy. And let me tell you, if you feel like you're in that boat, you are absolutely not alone. We often say at Triage Cancer that there should be a class in high school on how to navigate health insurance and finances, because those are two things that we all have to deal with as adults. But none of us are really ever taught how to do that. And it ends up sort of being a trial by fire, so to speak, in figuring all of it out. In addition to health insurance status, the employment changes that can occur after a cancer diagnosis can impact somebody's finances. And then all of the things that happen in life, like marriage, graduating, moving, big life events that can impact finances, well, those things continue to happen even after a cancer diagnosis. There's no pause button we get, just further compounding the issue. So today I'm going to talk about some of these pieces, but I really wanted to kind of take a step back and look at this more holistically when we talk about how to deal with medical debt, because there may be some other pieces we can help you with at Triage Cancer that I'm not going to have time to talk about today. So this is your Post-it note reminder, and usually I don't advertise using Post-it notes as a way to keep track of things, but this is an exception. This is your Post-it note reminder about making sure that you have adequate health insurance for you, because now we do have options as consumers to make different choices every single year come open enrollment. And so it's about making sure you have the right plan for you, that you understand your plan, and that you're really doing a cost comparison about those different plans. And we have some resources to help you do that, including a very short animated video. It's 5 minutes long. We have a 90-minute webinar where we get sort of into the weeds, and then we have lots of handouts and worksheets on our website that are all available for free. One of my favorites is this health insurance worksheet that walks you through how to do the cost comparison between two different plans. But the reality is, even if you have the best health insurance available, there are still going to be medical bills. So how do we cope with those bills? There are some things that we can do even before we've received care. And the first piece is about communication. So you have to communicate with your healthcare team about expected costs. Unfortunately, it is not the norm for us to talk with our healthcare providers about treatment costs. It is just bizarre to me because it is the only thing that we consume in this way in this country. Imagine if you were going to buy a new dishwasher and you went to Best Buy and you walked in and you asked the person in the blue shirt, hey, which is the best dishwasher for me? They said, this is the one you want. It will arrive at your house in 3 weeks. And then 3 weeks after that, you'll get a bill. And that's the point at which you will find out how much this dishwasher is going to cost. That would be totally ridiculous, right? No one would ever buy a dishwasher in that way. Yet, that is exactly how we consume healthcare in this country. We don't find out how much it's going to cost us sometimes until weeks, if not months, after we've received that care. So starting to address this issue around medical bills has to happen before the care is even received. And so it's having a conversation with the provider about, hey, what is a ballpark estimate of what you think this treatment costs? How long is it going to last? Certainly making sure all the providers are in your plan's network so that you are getting reimbursed or covered at a higher rate. There may be situations where a provider comes back and says, well, I actually have no idea how much that is going to cost. And that's okay, but at least you've started the conversation that cost is something that you are cognizant of. You're aware of it and you want to continue having conversations about it. Now, there may also be situations where maybe you need to see a provider that your health insurance doesn't cover. And so what then? Perhaps it's using a hospital's ability to pay program or discounts or financial assistance. There is an organization called $4 that will help sometimes negotiate lower costs. So that may be an option for you to think about as well. Now, if you know that the bill is going to be a certain amount that is perhaps higher than you can manage, you should feel empowered to negotiate with those providers before you've received care. So maybe you can negotiate with them if they're out of network to say, hey, if I'm going to pay cash right now, would you charge me the same amount you would take for an in-network patient? So you're basically going to get a cash discount. Again, I think it's about setting up a conversation beforehand so that there can be open lines of communication about cost. Sometimes it can be helpful to arrange independent lab work. So if you have a health insurance policy that has a certain lab that is in network, that lab might not be the same one that is in the facility where you see your oncologist, for example. So if that's an out-of-network lab, but the oncologist is just going to send samples there anyway, because that's the most convenient for them, who ends up paying for that? You do. And so if you figure out that that lab is out of network, and that's only going to happen if you ask questions, Perhaps what you can say is, you know what, I'm going to go get my blood drawn at this independent lab that is covered under my policy, and I will make sure that all results are forwarded to you as my provider. The same is true for other types of tests. So I know I'm currently in Chicago where I am, if there are lots of standalone MRI facilities, and those facilities tend to charge less than the MRI facilities within the larger hospital systems. So if somebody doesn't have a plan with those hospitals in network, maybe they can go to those independent facilities, still get the MRI, still get the films and everything sent to their provider, but it's going to cost them less because that independent MRI facility is in network. There is a website called Healthcare Blue Book, which will give you the average costs of tests in your area. That can also be very helpful for negotiating. So you can say, you know, I've found this facility is going to charge me this much. Would you accept that much if I were to get the test here? Sometimes it's about grouping follow-up appointments. So many health insurance policies have a co-payment, which is a dollar figure that you have to pay every time you see care. So maybe it's a $25 copayment when you go to your doctor's office, or a $30 copayment to see a specialist. Well, it could be that you need multiple things. So you need to get blood work done. So they're going to charge you a $20 copayment for that office visit. Then you need to go back in and get information about the results. Maybe that's another $20 copayment, or you need a specialist to look at the results. That's a $30 copayment. So because it's multiple separate appointments, those copayments could add up. So perhaps you could ask, is there any way that we can group those follow-up appointments so it all happens at the same time, so I'm only paying one copayment? Of course, this isn't always going to be possible, and there are legitimate reasons why things might need to be spread out. But again, the message I really want you to walk away with is it's okay to ask for these things. Because what we know to be true is that sometimes it's just about the schedule or looking at the computer saying, well, the next blood work appointment I have is Tuesday, and the next doctor's visit I have is Friday. So come on Tuesday and come on Friday. As opposed to, I really would need this all to happen at the same time. That can also help with some of those ancillary costs like parking, for example, or public transportation. If you're having to go back and forth multiple times, that's going to increase the expenses. So grouping those can help with that as well. Now, there are also some times when there might be a less expensive course of action that is equally effective. And so a great example of this is a generic medication versus a brand name. Of course, this may not always be possible, or there may be real reasons why a generic is not the best course of action for you. But when we look at these situations and we think, well, all things considered, if the generic is equally effective and has no counterindications for you, like you're not allergic to it, but it's going to cost less, have a conversation with the provider about if that's an okay substitute because of the cost factors. Now, with health insurance, many policies will require that for certain services, you get something called a prior authorization. This is a situation where you go to your insurance company before you receive care and essentially ask them, hey, I'm going to get this service. Are you going to cover it? There are so many challenges with prior authorizations, and there aren't always great solutions. But I talk about it because I want people to be aware so that, again, there can be a conversation here. One of the first challenges is this goes by a lot of different names. So prior authorizations, pre-auth, prior auth, prior approval, advanced approval, it all means the same thing. But it can be tricky because A, it's named different things. It's not always obvious what services you need a prior authorization for and which ones you don't need a prior authorization for. It's also really unclear to a lot of people whose responsibility it is to get the prior authorization. So I will tell you that while many healthcare providers will get the prior authorization on behalf of their patients as an extra service, at the end of the day, it is our responsibility as the patients to be getting those prior authorizations from our insurance companies. So if someone doesn't get a prior authorization for a service that the insurance company requires one for, the insurance company can come back and say, we're not going to cover that service purely because you didn't get the prior authorization. So this is a key piece to making sure that we're having insurance companies pay for what they should be paying for and not getting out of it because of theoretically a loophole. Now, if someone receives a denial of a prior authorization, that is something that can be appealed, which I'm going to come back and talk about in just a minute. But these prior authorizations are often needed for larger expenses like a surgery or a CT scan, or if you're going to be admitted to the hospital. I think the best course of action for people is if it is anything but sort of a routine visit, routine doctor's office visit, it's helpful to call your insurance company before you get the service and ask if you need a prior authorization for this service or not. Now, I mentioned that with prior authorization, there's lots of different names for exactly the same thing, and that happens a lot in the health insurance contexts. But sometimes there are terms that are used the same way that don't in fact mean the same thing. And one example of that is surprise billing and balance billing. So surprise billing is a situation where someone goes in for services and they think they're going to an in-network provider like a hospital, and their surgeon is in-network, and they've done their due diligence to make sure that they're going to a provider that is in-network. But then they end up with a surprise at the other end because they find out that somewhere along the care team, someone was not in network. I will tell you that many times it is the anesthesiologist that is out of network. So the person that you see for a few minutes before you're put to sleep before a procedure ends up being out of network, and then you end up with this giant out of network bill as a surprise. Surprise billing has become a bigger and bigger problem. States started to act to pass state laws to protect patients against these surprise bills. Now, the other term is balance billing. Balance billing is the difference between what the provider, like the doctor or the hospital, is going to charge and what the insurance company is going to pay for. Now, once a provider becomes part of that insurance company's network, they agree to accept a certain amount. And so now they are a preferred in-network provider. When someone sees an out-of-network patient, they can charge them whatever they want. And if the insurance company covers some amount for out-of-network providers, then the provider can balance bill for the remainder. So for example, if we have a situation where the provider charges $100 for a service and the insurance company covers 50% for an out-of-network provider, so the insurance company is going to pay the provider $50. Because that provider is out of network, the provider can turn around and ask the patient for the other $50 so that they get their $100. That is balance billing. If a provider is in network, they are not allowed to balance bill. So if, for example, if a provider charges $100, but the allowed amount, which is the amount that they have agreed to accept from the insurance company for this service, is $70, that is all they get. They only get $70. They are not allowed to turn around and bill the patient for the extra $30. So you see, surprise billing and balance billing are two different things. And unfortunately, the news and some providers talk about them as if they are the same thing. So if someone chooses to go to an out-of-network provider, they can be balanced billed. But if that out-of-network provider is a surprise, so it's a surprise bill, we actually now have a new federal protection. So regardless of where you live or receiving services, if you receive a surprise bill, you have some recourse now. And so it doesn't apply to every type of service. So for example, ground ambulances are not included in this new rule, but most other emergency and non-emergency medical services are. So if you have gone in and you've done your due diligence and everyone that you come in contact with is in network, if there's somewhere along the way that there's a surprise out of network bill, you are not going to be responsible for that anymore. So what do you do if you get what you think is a surprise bill? There is actually a federal no surprises help desk. It is an 800 number that you can call and talk to a live person, or there is a website where you can submit documentation and they will actually help you navigate between the insurance company and the provider so that you aren't being charged for these surprised bills. So this is a new provision. It did start at the beginning of last year, but it's really kind of ramping up, and many people still don't know about it. And these surprise bills are still a source of medical debt because people are getting these bills and thinking, oh my gosh, where am I going to come up with this money? Not necessarily realizing that it might be a surprise bill and they might not be responsible for paying for it. Now, what about the other bills? As I mentioned, even if you have the best health insurance possible, there are going to still be medical bills. And I generally do not think that this gentleman's coping strategy is a wise one. We definitely think people need to be facing their bills head on and utilizing some of these strategies I'm about to talk about. So once someone receives treatment, they could have a number of pieces of communication. So just from the insurance company, they could get something that says, hey, we've gotten a claim. And then something else that says, hey, now we're processing a claim. And then finally, they're going to get something called an explanation of benefits, or an EOB. An EOB can be identified by these big black letters somewhere on it that says, this is not a bill, because it is not actually the bill. It is from the health insurance company, and it is explaining to you what the health insurance company is and isn't going to cover based on what the providers have billed. So this, I will tell you, is an area that's hard for a lot of consumers because many EOBs look different. They don't have all of this information. Sometimes it's tricky to figure out what is actually being included in this EOB. So this is our gold star version of an EOB. It's going to have some information about who the policyholder is and who the patient is, because sometimes you might be on a family plan, for example. There's going to be a overarching summary of the dollar amounts that have been billed, approved, and what you may owe. Then there's going to be some details about the actual services. So there should always be a date and a CPT code, which is this 5-digit number here. Now, a good EOB may even have words under type of service so that you can actually understand what that service was for, but not all of them do. Then there should be something that talks about, okay, well, how much was charged by the provider? What was the allowed amount, the agreed upon amount that the person is going to accept, the provider is going to accept? And then the last section is going to be, well, where are you? How much do you owe? And that's going to vary based on, have you met your deductible yet? What's your co-insurance? But this will give you a good starting point to understand, well, how much would I be responsible for of this bill? Then a great EOB would also have some information about how much you've paid towards your annual deductible and how much you've paid towards any out-of-pocket maximums that may exist. Now, finally, the last piece of communication is from the provider themselves, the doctor, the hospital, the lab, the imaging center, and that's the bill. So the challenge with this process from a consumer's perspective, from our perspective, is that it doesn't always happen in this order. And many times the providers are much faster at sending the bills than the insurance companies are at processing the claims. So if someone went to go just pay a bill as soon as they get it, they may end up overpaying because the claim hasn't been processed by insurance yet. So the rule of thumb is you should never pay a hospital or, a medical bill before you look at your EOB. but it can't happen in a vacuum. You have to communicate with the provider. So what I do is the bill comes, I look at it, I'm like, I haven't gotten the EOB yet. I immediately call the provider and say, got the bill, just wanted to let you know I haven't gotten my EOB yet. Can you push the due date for the bill back? Or can you make a note in my file that I'm waiting on the EOB? In my many, many years of doing this, I've never heard that's a problem, because providers know that if the insurance company hasn't processed the claim yet, they could still be getting money from the providers. But if you don't communicate with the provider and just don't pay the bill and the due date comes and goes, that could potentially be a problem long term. Now, once you've gotten your EOBs and your bills, it is incredibly important to make sure that everything is accurate. There is a statistic that says between 7 and 80% of medical bills have errors. So that is a very wide range, obviously, but if we look at the top end, that's a whole lot of medical bills that have mistakes in them. And unfortunately, it is up to us as consumers to be checking those medical bills and making sure they are as accurate as possible. Now, if you get one of those EOBs where there's just those CPT codes and you're like, I have no idea what these things are, certainly you can call the provider and ask them to clarify. If you've had a really challenging or robust treatment situation and you have lots of bills and EOBs and you have no idea what's right or what isn't right, there are actually professional bill reviewers or medical claims organizations that will help you navigate this. They all work a little bit differently. Typically, what they will do is say, you know, if we get you any money back, we take a percentage of whatever we get you back. But also, in addition to making sure that everything is accurate, if you have received a denial where the insurance company has come back and said, we're not going to pay for that, that is something that you can appeal. Now, unfortunately, denials are a very common phenomenon in this country. About 200 million claims are denied per day by the insurance companies. But as consumers, we need to know that we don't have to take no for an answer. We have the right to appeal those decisions. Now, the details around appeals really do depend on the type of insurance that you have. So I'm going to give you an example using an individual plan or an employer-sponsored plan, but just know if you have another type of insurance, we have lots of resources on triagecancer.org to help you navigate the appeals process. Generally speaking, with individual or employer-sponsored insurance, you're going to have two levels of appeal. The first is what's called an internal appeal, where you are going back to the insurance company and asking them to reconsider their decision. Appeals can happen, as I mentioned, before services are received. So if you've asked for a prior authorization that's been denied, you can appeal at that point. You can also appeal if you've already received the services and gotten a claim denial at that point. As you can see, the timing for the appeals is going to depend on where you are in the process, as does the required time frame for the answer from the insurance company. But one thing here I want to just mention, if you haven't received care yet and you have put in for a prior authorization and the insurance company has said no, but the need for those services is urgent. And urgent could mean a lot of different things, but generally it's going to mean that delaying treatment is going to seriously jeopardize your life or overall health. Then you can ask for what's called an urgent or expedited appeal. And that's where you can appeal and the insurance company has to give you an answer within 72 hours. Now, if you have gone through the internal appeals process and the insurance company is still saying, no, we're not going to cover that, we now have the opportunity to have an external appeal. So this is the second level of appeal. And this is where you have an independent organization or entity that looks at the policy and your medical situation and makes a decision as to whether or not the insurance company should cover that service. The decision of the external appeals organization is binding. Now, I will say, I fully recognize that this appeals process is an added burden and challenge for patients and families. On top of everything else that you're dealing with, you now have to go back and essentially fight with the insurance company to get them to cover the service. So I fully recognize that it's one more thing added to the plate. But I will say that more often than not, it is worth your while to appeal the denials. And the reason I say that is that we know that somewhere between 40 and 60% of all appeals are decided in favor of the patient. So conservatively, we're talking about half the time when the insurance company is getting it wrong, or excuse me, when the insurance company is saying no, they're getting it wrong. So when we talk about dealing with medical bills and financial toxicity, making sure that insurance companies are paying their fair share of what they should be paying is a really important piece of that puzzle. Now, when we talk about external appeals, again, there's some timing requirements and some details, but generally you only have 4 months after the final internal denial to file your external appeal. But remember those situations that I said where getting those services might be urgent? In those cases, you can actually file the internal appeal at the same time as the external appeal, and both have to give you an answer within 72 hours. So that is a way to make sure that you are getting coverage, but that you're also not delaying care. If you receive a claim denial and you are considering appealing, there are some important steps in the process. And I think perhaps most importantly, you have to understand the why. Why was the claim denied? Sometimes it's administrative stuff like they spelled your name wrong. But in the cancer context, more often, it's about the idea that a service is considered experimental or investigational. So maybe that's an off-label drug use, for example. Or maybe they're saying, well, you're not eligible for the benefit under your plan. And we see this a lot in situations where perhaps someone's trying to get a cancer screening that might only be available for the opposite gender. So it's a man who's trying to get a breast cancer screening because they're at high risk due to family history. Well, insurance companies might say, you're not eligible for a breast cancer screening, you're a man. So understanding the why the claim was denied is really important to then understand what type of evidence do you need to gather to prove your point that the service is medically necessary, because medical necessity is the legal standard by which appeals will be decided. So what types of things speak to medical necessity? It could be a whole bunch of things. It could be a letter from the provider that asked you to get that particular screening. It could be any medical records or notes from your providers. Are there recent clinical trial findings that show that particular drug is great for the type of cancer that you have? So the evidence of medical necessity could be lots of different things. I think it's valuable to engage your healthcare team if you are appealing, because they're really going to be essential in helping you gather these medical necessity pieces. Now, I mentioned that I recognize that there's we're adding to somebody's plate and telling them to appeal, and that there are lots of hurdles or challenges when it comes to the appeals process. One of those challenges is really practical in that you have to stay organized. So there's going to be lots of conversations with insurance companies and providers, and maybe third parties of the insurance company. And so it can be a lot of conversations, and it can be a lot to keep track of. But it is valuable to keep track of names, dates, outcomes of conversations. Are there follow-up pieces that you need to send, for example? When are you expecting to hear back from them so that you can make sure to follow up if you haven't? So I often say, and I said it earlier today, that the Post-it note method is generally not a great way to keep track of this information. It doesn't really matter how you do it, if it makes sense for you. So a 3-ring binder or a spiral notebook is fine. You're keeping it all in the same place. At Triage Cancer, we have a free health insurance appeals tracking form that you can just download and print off. I really like this tracking form because I think it not only serves as a way to organize the information, but it also serves as a trigger to remember to ask for all those pieces of information, because there's an empty spot for you to fill in. So you're having the conversation, you can maybe forget to get somebody's name, but you see it right there. And so you think, oh yeah, I need your name. When should I expect to hear back? Is there anything you need from me? So I think the tracking form can be a really useful tool for people who need a little bit of extra help staying organized in this process. I also think this is a great time to engage friends and family. So many times people might hear from friends and family, I'm so sorry you're going through all this. Let me know if there's anything I can do. Well, you know what you can do? You can sit on the phone with me and take notes on this cool tracking form while I just have a conversation with the person, so that I'm not having to multitask to keep track of all of it. And that's something that can even be done if friends and family aren't physically near you, right? You get on the phone with everybody. So first hurdle is about staying organized. Second hurdle is about knowledge. Too many consumers of healthcare don't know that they have the right to appeal these denials. And I can say that because we have evidence. Just looking at the marketplace plans, so those are individual policies, in 2021, of the 48 million claims that were denied, less than 0.1% were appealed. That means 99.9% of the denied claims were never appealed. But remember I said that on average, about half the time when the insurance company is denying a claim, they're getting it wrong. This is a disconnect again, and a place where we can start to address medical bills systemically. And so if you receive a denial of care, I strongly urge you to at least investigate the appeals process. And as I mentioned, we have lots of tools at triagecancer.org. They're all free. They're all available online. You can print them off. There's some videos, there's recorded webinars to help you walk through the various pieces of how to appeal your denial. Now, getting organized isn't just important when we're talking about appeals. You also want to make sure you're keeping track of medical bills, any payments you've made, any prior authorizations you've made, and any unreimbursed medical expenses. The reason for that is that they may be tax deductible. So that might be a money savings for you. But all of this is a lot to keep track of, especially when we're talking about the medical bills piece. So we've created a tool at Triage Cancer called our Medical Bills Tracker. It is an Excel document or a Google Sheets document that you can download for free. I've given you the website up here. And what's useful about this spreadsheet is it not only helps you track the individual bills and where they are, but it can help you with understanding how much you have to pay still to meet your deductible and how much you have to pay to meet your out-of-pocket maximum. Your out-of-pocket maximum is, in theory, the most you're going to have to pay out of pocket for your healthcare. So how does this sheet work? Well, I've blown up the top part so you can put some information in about your insurance policy. So here, this person has a $1,000 deductible and an $8,000 out-of-pocket maximum. Then, as they start getting medical bills, they fill them in down below. And you can see, you can put the total amount billed, how much you paid, how did you pay for it? So was it a check or a credit card? Do you need to appeal it? If you have a flexible spending account or a healthcare spending account, you can certainly keep track of if you've submitted it to them yet or not, and then any other notes that you might have. Then, as you fill in these lines below, the spreadsheet will start to deduct how much you have left to pay to meet your deductible or your out-of-pocket maximum. So it's a really simple way for you to be able to pull up and say, oh, I have $7,000 left to meet my out-of-pocket maximum, or I've already met my out-of-pocket maximum, so I know that all I have to pay for the rest of the year is my monthly premiums. So I think this spreadsheet is helpful for people with lots of different medical bills who are struggling to keep track of all of them. When we talk about staying organized, for some people, this comes very naturally. For some people, it is more challenging. Sometimes it becomes more challenging after a diagnosis because you may be dealing with chemo brain or concentration problems. So again, if you're struggling with this, just please know you're not alone. And there are all sorts of organizational systems out there to help you. Which is the best one? Again, it does not matter. It is the best one is the one that you're going to be able to use and maintain. So is that file folders in a box? Is it a 3-ring binder? Is it electronic files? There are some pre-built planners that you can pay for that help you guide your organizational system. We have 3 archived webinars on our website that go into depth about the nitty-gritty of how to get organized and dealing with all the paper. One other thing I wanted to make sure I mentioned was around medical debt. And so medical debt, there were lots of challenges with it, but one of the challenges is that it really could impact somebody's credit. And that could impact other pieces around financial health. And so the sort of breaking news of last summer is that the 3 major credit bureaus, Equifax, Experian, and TransUnion, have now said that if people pay off their medical debt, that's no longer going to be kept on their credit report. People also have more time to pay for medical debts. And starting, we think, sometime soon this year, if the debt is less than $500, it's not going to be included on credit reports. But that doesn't mean that we can just ignore the medical debt. We still have to deal with it. And so if you are having trouble paying your bills, make sure you reach out to the providers before those bills are sent to collection agencies. Once collection agencies get those bills, it becomes a lot harder to deal with them. So what are the types of things that you can ask for? Well, certainly you can ask for more time. You can see if they'll accept a lower lump sum. So listen, if I know I owe you $1,000, but if I pay you $500 cash right now, will you wipe out the rest? Could you set up a payment plan with me? So this is a kind of situation that is certainly helpful for medical bills, but also other creditors. So landlords or credit card companies or other types of debt that you might have, having a conversation with them and sometimes even explaining the why. You know, I'm struggling with this because I'm not working right now because I'm in cancer treatment, but I don't expect it to be a long-term problem. Can go a long way. Now, I mentioned that some of those unpaid or unreimbursed medical expenses could be tax deductible. Taxes is not something that people automatically think of as a potential source of income when they're thinking about medical bills, but it could be. And so when we're talking about taxes, certainly there are individuals who are required by federal and state law to file taxes because their income is over a certain amount. But sometimes even people whose income may be below that amount could benefit from filing taxes. And that's certainly a situation if you've had self-employment earnings. So I know there's a lot of people who may take up gig work like DoorDash or Uber to sort of supplement income if they can't work full time, for example. That might be self-employment taxes. But also, if you received financial assistance to buy a health insurance policy through the marketplace, you need to file your taxes, even if you've made under a certain amount. But even if none of those situations apply to you, you may actually benefit from filing your taxes anyway. And this is where it comes into play that filing your taxes could actually be a source of income. So it might be that you worked a little bit and you've had taxes withheld from your pay, but your income wasn't high enough to owe taxes. So you could get that money back. It could also be that you have tax credits like an earned income tax or a child tax. There's education tax credits. That is actually money that could be money in your hand, but you have to file those in order to receive. So keep in mind that even if you earn under that amount, it may be to your benefit to file your taxes. And then, of course, those unreimbursed medical expenses, and it could be things like If you've had expenses that aren't covered by health insurance or your dental insurance, or even things like travel and parking to receive your health care. If all those expenses added up are more than 7.5% of your adjusted gross income, you can deduct those expenses from your taxes, which means your tax amount is reduced, and that could be money back in your pocket. So tax day is coming up very, very soon, which is why I wanted to spend a few minutes talking about it today. There are lots of different ways to prepare your taxes. There's tons of different DIY options, online options, for example, like H&R Block. You could hire an accountant or a tax lawyer, depending on how complicated your situation might be. But there are also some places to get some free help. So there is a volunteer income tax assistance program, VITA. You can go to the IRS website and find a person near you to help you complete your tax returns for free. For individuals over a certain age, they could get help through AARP. So I just bring this up because sometimes people think, oh, I don't need to file taxes because my income was too low and I can't afford to get help doing it anyway. But they may be leaving money on the table. Now, of course, we can't talk about dealing with medical bills without talking about financial assistance, because the reality is, even if you've done everything right, you have the best health insurance policy, you've appealed denials, you're, budgeting and saving, there may simply not be enough money to pay all the bills. And that is where financial assistance can be very, very useful. There are a number of sources of financial assistance. So we have a tool on our website called cancerfinances.org. And if you go to the financial assistance options module, you will see that there are different sources. So it could be about local, state, or county organizations, community organizations. There are a number of cancer organizations that provide financial assistance. I believe Texas Oncology Foundation is one of them. There are private programs that can help with medical expenses and other expenses. So if you go to cancerfinances.org and you pick financial assistance, this is the screen, it's broken down into different categories. And so you can look for help paying for childcare or for dental care. One of the things that I see happening with people, though, is they get tunnel vision and they think, I have this giant medical bill that I can't afford. I need help with medical bills, but I can't find any assistance for this bill. What I will generally say to them is, well, are there any other types of assistance you might be eligible for? So can you get help with utilities or rent? Then you can shift the money that you had earmarked for rent over to pay for the medical bill. So when you're on this tool, I suggest you think as broadly as possible about any type of assistance you might be eligible for, and then actually go through each program to see what might work for you or not. Every one of the programs has a different eligibility and application process. So there's no quick way to apply. We wish there was one like universal application and all the financial assistance programs would use it, but unfortunately, we're not there yet. So it does require some legwork on our end as well. Now, another source of financial assistance that some people don't always think about is with prescription drugs. So most pharmaceutical companies and specialty pharmacies have assistance programs. And certainly they can help with the financial aspects like copay assistance or free drugs, but they may also provide some added benefits or additional benefits like prior authorization help or information that you can use if your insurance is denying covering that particular drug. So how do you actually find the right financial assistance program? We have a tool on Cancer Finances again, where you can pick help paying for prescription drugs. You can search the name of the prescription drug that you're taking or the disease state. So that would be your cancer diagnosis. And then this system will narrow down the different companies that offer pharmaceutical assistance for those types of diagnoses or by prescription. And then it shows you on the right-hand column what type of assistance. So is it financial assistance? Is it co-pay assistance? Is it a discount? And then there's a link to the actual application right there for you. Now, a couple just quick things I want to end with, and then I'm happy to take whatever questions there might be. Another source of income could be enlisting friends and family. And this has become increasingly more popular over the last couple of years with crowdfunding. So GoFundMe is a great example of that. Wonderful way to engage friends and family, provided you have thought through all of the ramifications. So certainly understanding the disclosure ramifications. So if you are not disclosing or telling people widely about your cancer diagnosis, crowdfunding can be challenging, because those stories that are told at the beginning of a crowdfunding campaign are Googleable, and that becomes public information. It could also impact other programs that you have access to. So if you are receiving Medicaid or SNAP benefits or housing benefits or student aid, those are typically financially based programs. If you get a lump sum from a crowdfunding campaign, that could jeopardize access to those programs. There are some solutions and workarounds in order to be able to do both, and we've outlined them in our quick guide to crowdfunding. Now, the last couple of programs I want to talk about are not specific to cancer at all. But again, when we talk about thinking creatively, it is about thinking about all the different sources of help and how they can be pieced together to provide a patchwork of assistance. And so Temporary Assistance for Needy Families, or TANF, is a federal grant that states can then help individuals with low incomes that have children financially. And so there's details here. And many times the different types of financial assistance are linked together. So in a lot of states, if you are receiving supplemental security income through the Social Security Administration, you're also eligible for Medicaid for your health insurance, and you may also be eligible for TANF, for example. Food security or food insecurity is a major, major problem in this country, and the pandemic only made this a bigger problem. There are a variety of places to receive assistance in obtaining food, including through SNAP, which used to be known as food stamps, but it is now more widely known as the Supplemental Nutrition Assistance Program, or SNAP. WIC is for women, infants, and children. There's a senior program. And the USDA has a national hunger hotline, which I think is a great place to start because they can also help point you to local resources. There are some programs that can help with rental assistance, although I will be perfectly frank with you and let you know that these are tapped programs at the moment. I'm not suggesting that if you qualify and could benefit from it, you don't try them, but I just like to manage expectations. Now, another place a lot of people don't think about receiving help is through utilities. So there's the LIHEAP program, which is to help individuals with lower incomes get gas and electricity. There's a water assistance program. There are a couple of programs to help access phones and internet. As we know, and I've shown you, many of these programs require internet access, or you can benefit if you have internet access by applying online. That's a cost, that's an expense to households. These programs may be helpful. So I know I went through those really quickly because not all of them are going to apply to everybody, but know that you can get more information on triagecancer.org. And we have a quick guide specifically to help people find financial assistance. It's not a quick guide, I'm sorry, it's a checklist. So with that, I'm going to open it up for questions. But while I see them coming in, I do just want to mention 2 additional resources. The Triage Cancer conferences are free day-long events on May 20th and October 14th this year. They are virtual, so you can just join from wherever you are. If you are interested in learning more about these other topics, health insurance, employment, disability, estate planning, finances, we cover all of those at our conferences. You are welcome to join us. All you have to do is register on our website. And then we also have an opportunity for you to get one-on-one questions answered through our legal and financial navigation program. This is a relatively new program that we have, but it's for individuals who've been diagnosed, caregivers, or healthcare professionals if they have questions on behalf of their patients. All you have to do is fill out a form on our website at triagecancer.org/get-help. And let us know a little bit about what your question is, what you need help with, and then we schedule an appointment with you and we get on the phone and we talk through your situation. We generally are answering questions around health insurance, employment, disability insurance, estate planning, for example. But our goal with the navigation program is to really explain somebody's options based on their situation. So where they live, employer size, income level, for example, is going to really dictate what types of programs they might have access to. And then we give people the next steps to take so that they can then turn around and be self-advocates. There's no charge to use the legal and financial navigation program. I will say we don't represent people, so we can't be your lawyer, and we don't provide financial assistance as an organization, but our goal is to really give you the information and the tools to be able to then turn around and hopefully solve or eliminate any problems that you may be currently having. And so this is all the different ways you can be connected to Triage Cancer, and I'm going to just leave that up there while I take a look to see if there are any questions. So there is, oh, Rachel, did you want to?
Yeah, thank you so much for all that you've talked about, Monica, and your willingness to answer some questions. It is 12:02, so I just wanted to give you a heads up. We'll probably only answer a couple questions just to keep time. But I did see a couple in there that were great and amazing, and I just wanted to give you a heads up that I've learned so much from you in the past 45, 50 minutes. It's incredible how much information you have for our participants. So thank you.
Thank you so much. Delighted to be here.
So it looks like we do have a couple in the Q&A if you'd like to read those. And then we have a couple questions in the chat as well.
Sure. So what I can do is there's a question about the links and stuff. I can actually send Rachel a resource document with clickable links. If she wants to send it out to whomever or post it on the website, I'm happy to do that so that you can figure out where you are going. There's also a question about, can we appeal denials for meds? Absolutely. So if you have gotten a denial from your insurance company for a prescription medication or a piece of durable medical equipment like a wheelchair, those types of denials can absolutely be appealed.
Yeah, and as we said, like less than 1% of people are appealing them. So
less than 0.1%. Yeah, it's even less than 1%, right? So it is truly astronomical how many claims aren't getting appealed. There is a list of papers that you should keep. We call it our checklist to getting organized that you can find on our website under the estate planning section. So you can take a look at that. So there's a question about the teacher retirement system and applying for Social Security disability. That is going to be a very situationally specific question, and the answer to you is going to be maybe. And what I would ask you to do, if you'd like to talk to us, is go to this website at triagecancer.org/get-help. Fill out the form, and then you'll get an email with a link to schedule an appointment so that we can ask some questions and make sure that we're getting you the most accurate information for your situation. Because unions and Social Security Administration are all a little bit different.
Yeah.
So I think that was it.
And I think one of the last questions was just someone was waiting for their explanation of benefits, their EOB. And it was sent to a debt collector within the time that they were waiting for it. What should they do in that scenario?
So I think that this is a good example of why it's so helpful to communicate with the provider. But if it's already been sent to the debt collector and the EOB shows that the insurance company paid a portion, you can certainly send that EOB to the debt collector to show that you don't owe that full amount. Hopefully it reduces the amount based on what the insurance company has paid that you can just pay off through the debt collector. But if you didn't pay because the insurance hadn't processed the claim, that's definitely something you're going to want to let the debt collection agency know so that they can reprocess it appropriately.
I think that was all the questions. There were a lot.
Well, thank you for keeping track of it, and thank you all for being so engaged. I certainly hope that you found it helpful and that you will continue to engage with both Triage Cancer and Texas Oncology.
You can go to our Texas Oncology Foundation website or on our Facebook page to stay current with the foundation there as well. We do have 2 upcoming webinars in the May. We have one on May 9th and one on May 16th. And we will be talking more about Mother's Day and families and genetics in May. So if you're interested in anything like that, considering family, or if you're a mom or a parent, or want your mom or parent to listen into our webinars on May, then mark your calendars for May 9th and May 16th. We also have our ambassadors group. If you have previously participated with our symposiums or webinars, just look into keeping that communication and those connections through our ambassadors groups. And you can email me at rachel.perkins@usoncology.com if you're interested in that as well. And then lastly, we value your feedback from this webinar. And we will be giving you a link to do a survey and follow-up emails. And just take a moment, it takes 1 to 2 minutes to provide us information, what you liked about the presentation today, maybe future topics you're interested in. That'll help us kind of guide, what topics we need to give our audience. So thank you so much for coming today. Thank you again, Monica, for speaking with us. We really appreciate you guys, and we will see you in May.